Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world who are sharing their expertise and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of HLH Growth Solutions. We help businesses grow using outside-the-box visibility strategies. If you're new to the podcast, we're glad you're here. Welcome. And please stay to the end because I have a special gift for you. Let's get started. I want to dive in and talk with my guest today, James Hamet with Vistim Labs. So welcome, James, to the podcast.
Thank you so much for having me. It's such a pleasure.
It's a pleasure to be talking with you today. Thank you for taking time out of your busy schedule. James, let's just dive in. Can you share with us a little bit about yourself, about Vistim Labs, and your role within the company?
Yeah, of course. So my name is James Hamet. As you know, I'm the CEO and founder of Vistim Labs. And what Vistim Labs does is we solve the most important part in treating neurological conditions, knowing when treatment is working. We have amazing technologies out in the field, PET scans, MRIs, new blood tests. I mean, there's all these endpoints now that doctors can look at, but none of them tell you if therapy is working. I think PET scans possibly could, except you can't do them repeatedly. That would only cause a brain tumor to be a new problem for the patient. But now we have a non-radioactive method of doing this. It also doesn't require a specialized facility like a hospital. We're able to do structural brain imaging with EEG. And so you can get the same output that you might expect from a PET scan or an MRI. You get the outputs of cognitive tests as well from the same EEG system. And so basically it's every test in one, and it goes a level deeper as well.
Wow, I've never heard of this. It's amazing. Can you share, do you have like a why or what inspired you to lean in and created your vision to start Vistim Labs?
Thank you. Yeah, I started Vistim Labs because, primarily, I've had Parkinson's in my family, and I used to work on mind reading technology for telekinetic control of wheelchairs. And I just thought that neurology was so behind when it comes to knowing when treatments are working. In the cardiology space, with diabetes, we have insulin monitors. We can see that the person, what they need and when and how much, insulin, for example. Actually, cardiology is a fantastic analogy because in cardiology, we have cardiac mapping. We can see how the heart is acting in real time, what it's doing, how well it's performing its role. That's a technology that's relatively new. It came out 30 years ago. That technology led to a 60% decrease in cardiac deaths. So certainly very meaningful. And I think that we have the same opportunity here in neurology. Once we can see the brain in real time and we can see how treatments are affecting brain behavior, we can have success. We can see reversal of disease. We can see cures, not just alleviation of symptoms. And I'm really excited to be part of this.
Can you share with us a little, I'm curious about how this all works. Are you able to share with us, kind of like walk us through the process?
Yeah, sure. When a patient comes to see a neurologist, what they want to know really is what treatments to be prescribed, but more importantly, is the treatment that I'm getting working? Trust is a huge factor in health. And so this is kind of like stepping on the scale when you're in a weight loss program, being able to see how well you're doing. It's incredibly motivating when you see that your therapy is working. It builds on that trust between the physician and the patient. It also enables a placebo effect, which is non-negligible. Seeing that you're doing better does cause you to recover even faster. But also, what happens when it doesn't work? What happens when a system like ours shows that the therapy is the wrong therapy? At the moment, you don't have that insight. How many patients are receiving the wrong therapy and not responding? That number is really high. It's something around 40%. It varies basically on a case-by-case basis, depending on the institute. Some are going to be better than others. But Parkinson's, Alzheimer's, these are diseases that have similar symptoms. They're very easy to confuse. And even when you talk about Lewy body disease, of which Parkinson's is one, you're dealing with multiple disorders that do, in fact, require different treatments. There's a form of Parkinson's, if we speak just on Parkinson's, that responds to dopamine therapy. And there's also a form of Parkinson's that does not. So that's just to put that information out there. Alzheimer's is similar. We have different types of Alzheimer's. I don't know what they're called. I don't believe that they have names yet, but with our system, we're identifying different subcategories of Alzheimer's. And I think this might explain why patients recover with some therapies, but then other patients do not have the same response. I was speaking with a neurologist in Missouri yesterday, Dr. Ken Charlin. He's actually a friend of mine through our conversations. And he's successfully reversing Alzheimer's disease. And he's not alone. He's successfully reversing it for patients. But he brought up that same frustration of not everybody's responding and I don't know why. And so our tool, it's solving a very big problem in multiple ways. But to help someone like Dr. Charlin know which patients will respond to which therapies, that's how he can get positive response for all of his patients. It's by tailoring those treatments so that they're personalized, patient specific.
Yeah, so not every treatment, not everything is a one size fits all, right? We're all different, we're all unique. And I love that what you're doing is allowing for people to find out sooner than later that a treatment isn't working on that side, but also is working, because mindset and like you said, the placebo effect kicks in. When people see that it is working, they're more motivated to continue. They're more
wouldn't
excited.
be?
Right. Their mindset shifts, and positivity is a great healer, right? So because I can imagine when somebody gets diagnosed with a neurological disorder, it's scary, right? It's
incredibly frightening. Yeah.
And that doesn't help the illness. It hinders it more, because then that fear kicks in, which doesn't promote healing. It promotes, the other side of it. So I love that people can find that out and the doctors can know sooner than later. Yes, it's working, or no, it's not working. And we need to make this adjustment sooner than later, which is fantastic. Because in business, this is a business podcast, we talk about you need to reevaluate everything, or be looking at what's working, what's not working. Keep doing what's working and tweak what's not working, which is exactly what your product does. So in regards to, when you're reaching out, you talk to actual doctors. This is where your target market is. Am I correct?
Yes, that's correct.
It's in their hands.
This is sold to physicians, and then the physicians use it with their patients.
Is there a training period that goes into it, or is it pretty simple for them to get up and running?
Very simple to get up and running. It actually takes 10 minutes, and there's a video that we give to clinics. It takes 10 minutes to know what you need to know on how to use this with patients, and then you can get started right away. The procedure is only 30 minutes. So, in the world of neurology, we refer to our technology as instant imaging. 30 minutes might not feel like instant, but when you're dealing with PET scans that can take up to 2 years to schedule, something where you can walk in and walk out with same day answers, that's instant. Yeah.
So you had mentioned that PET scans, you can't keep doing those. They'd actually hinder the patient more than help them. How is yours different in that it's safe?
Yeah. So we're using EEG. EEG is basically a swim cap with electrodes on it. No signals are going into the brain through the hardware. The person doesn't have to drink radioactive fluid as they do with a PET scan. That's the safety concern with the PET scan, which is why, more than once a year is actually quite dangerous. They only do that for people who already have brain tumors, because the logic is, well, they already have a tumor. Is it going to get much worse with more radiation? It gets a little worse, but they're being treated at the same time. And so, yeah, this is very safe. It's also portable, fits in a suitcase. You can fly with it. But yeah, it's not sold to the patients directly. It's not meant to be something you have at home, because it's not something you need all the time. It's something that you might need monthly or quarterly to see how you're doing with your therapy, to see if there are opportunities to improve. I know that there's a lot of health hackers out there, people who are looking to optimize. I think the general population is being more educated on the power of selecting healthier ingredients for their food, for what they eat. We all know the power of better sleep hygiene, better workout routines. And so a tool like this is very useful for the patient to also experiment and to test. Okay, if I change my diet a little bit, which is a hard thing to do. If I change my diet a little bit, is that accelerating my improvement? And if that is, it's so motivating. And there's this concept in the field called neurofeedback, where just seeing that you're improving is helpful to you. And we're not talking about, in this case, placebo. The brain has very powerful subconscious capabilities. And when you have this positive or negative, hot or cold feedback, it allows your neuroplasticity to leverage that subconsciousness, that subconscious power to help you with your improvements, to help you manage your diseases. One of the most clear-cut cases, for example, of neurofeedback is, if we think about life alert and the risk of patients, elderly patients falling and not being able to catch themselves when they fall. I was actually at an institute in upstate New York, Albany, New York, where neurofeedback was used with these patients to retrain their spine, the neurons in their spine, to be more responsive to when the patient was falling. They would have the electrodes on the person's leg and on their back. The person would be actually hanging from the ceiling. They'd have, protection so that when they fell, they wouldn't fall on the ground. But then they would experience a series of simulated trips. They would have a conveyor belt with some obstacles and they would fall, that they would be caught by this mechanism, and their electrical activity would be converted into, in their muscles, would be converted into a red, yellow, green symbol on a computer screen. And we would tell the patients, try to make the color green. It seems kind of impossible. They didn't have any more feedback than that. But after a few weeks of this therapy, their responsiveness increased, and it was amazing. They were able to successfully, without consciously knowing how, they were able to get to green. And once they were in that green zone, then they routinely were able to catch themselves when they fell.
You're training the brain to remember these movements, right?
Yeah. And for any of the, scientists listening in on the call, or people who naturally understand, that well, there's a learning effect, right, of being in a repeated environment. It's important for you to know that there was a control group, and without the neurofeedback, the rate of learning was much, much slower. We actually do have some hypotheses as to why the neurofeedback is working the way that it does, and that hypothesis is that getting the color shift to green is basically giving your brain positive response, that you are building the neurons, having greater neuron density in those areas of muscle that matter, even before having the feedback of, no longer tripping. If your brain doesn't have that feedback, how does it know that what it's doing is going in the right direction? So that's why the process takes longer without the feedback.
Wow. Yeah, positivity really is a powerful healer, right?
Well, feedback mechanisms.
Feedback.
I come from a electrical engineering background. And that includes control systems theory, if anyone's familiar with that. Without feedback, without action reaction, it's impossible to get better. Athletes, they're not just playing the same sport every day and getting better. They're also looking at how they're doing. What's my time? If I'm a basketball player, how many shots am I taking? And how often are they a miss, right? The more we can quantify, the more we can have change at the very small scale. How can I go from 30 shots on goal to 31 shots on goal? How can I go from 20 pull-ups to 21 pull-ups? That is where you see the difference. And actually, Bruce Lee would say the same. He would always say that, the workout, if anyone's a fan of movie stars, the workout doesn't begin until you've done what you've done previously. So if doing 20 push-ups is something you do routinely, okay, then that's your warm-up. Your workout starts at 21.
I've never heard that. That's fantastic.
Yeah. Well, because if you're the same as you were yesterday, has anything changed?
We're not.
And the body is so powerful with homeostasis. We are so good at staying at where we are, that the body, it's a good thing for us, right? It helps the body avoid falling back so quickly. It'd be very frustrating if you could do 20 pull-ups one day and then the next day you can only do 10, right? But it has a catch. And the catch is that, well, it's also difficult to do more. So we're very good. Our bodies are very, very good at staying stable. But if you want to go above and beyond, you have to push yourself. And I know that you as a business leader, you understand that. Without KPIs, you're working in the dark.
Absolutely. So James, in your space, like many companies face regulatory hurdles, long sales cycles, and high development costs. So what have been the biggest barriers for Vistim And how are you overcoming those barriers?
That's a good question. Let's see. I would say that our biggest barrier is that, well, the first one, let's talk about obvious barriers. It's difficult to commercialize a medical product just from a pure regulatory perspective. So I do have a product on the market. It is available. It is in clinics. And if anyone is listening and knows a neurologist, please connect us. They're going to be happy you did, because they'll be making more money while they're helping patients. Getting across the FDA approval is challenging. There's another component which is less obvious, which is the reimbursement piece. Getting a technology reimbursed by insurance is absolutely necessary. When I was early in the space, I thought, oh, well, patients, can't always afford procedures, so it's for the patients. But I was wrong. The insurance reimbursement is actually more for the physician. The physician is only able to do procedures that make financial sense for their clinic, because the clinic is itself a business. Even if you offer something that is fully out of pocket and the patients can afford to cover the procedure, it introduces business risk. And that business risk is actually so much more important than the patient's ability to pay out of pocket, because it changes the ability to forecast the performance of the business. And so it makes technologies like mine a little bit more challenging to commercialize. There are reimbursement codes for what we're doing, but there's more work to be done. There are other versions of this product that I'd like to release that have stronger claims that will require advanced FDA approvals. There are ways of using this product that I believe deserve and merit their own CPT codes that are worth more than the codes that are used today. And so those, I would say, are my biggest barriers. When we talk from a growth perspective, what about reaching physicians and commercializing this technology? I'd say that one barrier that I am encountering somewhat frequently is just the disbelief. If you know what EEG does and is, and if you know what PET scans are, then the concept of getting the same result from both, it's very counterintuitive. And our technology is, in fact, very, very counterintuitive. But that's one of the reasons it's so precise as well. It's because we are looking at things in a very different way. And that different way is what has changed how EEG has been used for the past 100 years and made it into something new.
I'm curious for leaders. So for leaders listening and they're building high-tech, mission-driven companies, what organizational or cultural dynamics have you found to be the most critical for scaling successfully?
It's difficult to answer that question because I am essentially working on my own.
Oh, you're doing it all.
Yeah. And, that's not to say that, I deserve all the credit. We have fantastic research collaborators around the world. We have some really incredible consultants who've helped us, some board members who've been who've been invaluable, not just for helping the company grow, but for helping me learn. So, from that perspective, I would say maybe humility is a critical foundational piece to the culture that leads to success. Another thing that I might say is focusing on the customer above everything else. And by customer, I mean every person who is benefiting. Maybe end user is the better word, but I don't want to limit it to just the patient, right? Because it also includes the doctor and the nurse and the physician's assistant. Everybody in that chain has to benefit from the technology in a meaningful way. So I would say that that's absolutely critical. Don't be blinded by the money. Sometimes focusing on the money will lead to short-term local maximas, but then it can stunt the business long-term. I guess the final thing, so I said humility, I said focus on, the users. The final thing that I might say from a cultural perspective is, I don't know, I feel like just coming back to that humility, being willing to accept help, being willing to receive help. I guess now I'm just elaborating, but being willing to be wrong. Well, maybe I'll change it in a little way, and by saying generosity. I mentioned that I have a lot of support from some amazing researchers around the world. That's thanks to their generosity, them wanting to help me and help this technology reach patients. But generosity is reciprocal. And in many ways, these researchers have worked with me thanks to my generosity to them. So for a lot of researchers at the very beginning, we were giving this technology for free, and it was mutual collaboration on the research. We wouldn't pay the researcher wouldn't pay us, and we would just publish together as true, intellectual collaborators. And it's thanks to that generosity that I showed and the generosity that they showed that we were able to create something really beautiful together.
Yeah, I love that, everything you just said. So thank you for that. Let's talk a little pivot to, say, getting in touch with these doctors. And then you have multiple end users, which you just shared. You have the doctor,
Yes.
you have the nurses, and you have the patients, which is very interesting in itself. What are the ways that you're getting in front of these doctors and these neurologists? And I would thank you for sharing. If any of you listeners know a neurologist, please share, and we'll give you the information on how to connect with James toward the end of this interview. But I was going to ask you that, so I'm glad that you shared that, because that's important. The more people out there that are hearing what you're doing and learning about your product and your mission, the more that we can support you in doing that. And asking is a big piece. You said receiving, but also asking for that help is huge too. A lot of us as founders, CEOs, we're kind of lone wolfers sometimes, especially when you're doing this on
very
your own.
often.
Yeah, we find ourselves as lone wolfers, and it's hard to ask. So asking is a huge piece. What are some of the ways that you're getting in front of them as far as visibility? It's really important that you're being seen by these neurologists in order to get this into their hands, or even get the knowledge to them. So what are the ways that you're doing that? Podcasting is obviously one of them, because you're here, and you've told me that behind the scenes that you've done a lot of podcasts. What are other ways that have worked for you? And then on the flip side, James, are there any avenues that you've tried that haven't worked for you?
That's a good question. I would say, I've tried a lot of different strategies. My favorite strategy is, scientific conferences. I know that this is also probably something that's top of mind for anyone listening. If you're going to go into medicine, go into science, it's really important to present your work, to get publications, to create posters, to go to the conferences, to speak with the key opinion leaders directly in person. And so I go to all those conferences: Alzheimer's and Parkinson's International Conference, American Academy of Neurology, and we put our technology out there. We submit abstracts, we submit posters, we get everything peer reviewed, and we make our bold claims there. And we humbly ask for and respond to criticisms and feedback. We use that to design better and better studies, to answer the questions that are still unanswered. And I would say that, with the first sale of our products, for example, it's nice to have revenue. In medicine, you can wait a long time before you have revenue. But what was more valuable for me was actually the feedback, because I'm not a physician. I'm not dealing with these patients directly. And so hearing from the doctor what's working, what's not working, what they need, that's worth more than money, because that's telling me how to solve the problem that matters to them most. And that's what an entrepreneur is. We're here to solve problems. So that's my favorite strategy. I'd say conferences, in person, and these aren't trade shows. These are, true scientific conferences with poster presentations. Now, other things we've tried, I've tried cold emailing. There's a lot of these AI companies now that are doing that. I have to say, I don't like it. I'm not a fan. Even when the AI, reads the person's website and makes an email that's a little bit more personal, I still feel like it's so inauthentic. And I know that we actually have really good response rate on email campaigns like that, but it's almost 10% response rate. So anyone who's in marketing is, they're gonna say, what? On cold email?
That's good.
But yeah, I still haven't found a way to enjoy that part of the process, especially when I get cold emails too. And many times, the AI is wrong, and it's like, hey, you're doing this for doctors and you need this product, and it's just so irrelevant. So targeting, it needs to be done better. But I've also done cold calls, and I've circulated flyers. I don't really have a marketing background, so there might be some ideas I haven't done yet. I also know that marketing sometimes is better when you have more budget for it. Running TV ads, maybe putting an actual banner on a building. I can't afford these things, but I do know that when people find out about our product, especially patients, when they find out, they ask, I've always been looking for answers. as to, is my therapy working, or is my dad's therapy, is my mom's therapy working? And yours seems like the only one who can answer that question. Where do I go? This is my zip code. Where do I go? I really hope we can get the technology out there faster so that some of these patients don't have to fly, for multiple hours just to get to a clinic that has our technology.
Yeah. So that brings up a question for me. Do you have a resource on your website or somewhere that shows so for the patients that do hear about you and they want to work with a doctor that has that, do you have that network or that list somewhere that's readily available for patients to say, okay, these are the doctors that are currently using this. We are growing, but these are the doctors that are currently, because that could be something that's like beneficial for the doctors too. Like they're going to be on this platform where more patients can find them because they're using your technology.
Yeah, that's a very good point. I would say that we have a contact form that does, ask for and accept your zip code, and then we'll do what we can to match you.
That's awesome. So for those of you listening who are moving through a neurological challenge and you want to work with a doctor that has this, then definitely be reaching out so you can find them through James. James, what's next for you all? What's for Vistim Labs for, like, say, the next 12 months? What are your big goals?
Yeah, that's a good question. I would say that for us, what comes next would be just getting this technology further available for patients. I mean, the reason I created this technology started with the unavailability of PET scans. Having to wait 2 years to get an image, just to get a diagnosis, just to get a treatment, it almost makes you want to give up even before you start. For many patients, PET scans are just not even a possibility. They're extremely expensive. It's $10,000 in some cases to get one PET scan. And you have to go, once again, specialized facility, maybe you have to drive or fly. I created this technology for access, and access remains and will probably always remain my number one priority.
If I could give you a magic wand and you can wave it over one challenge that you're having right now that you'd like to go poof and it disappears for you, what would that challenge or issue be and why?
That's a good question. So time is the most valuable resource, and I think time modulates all of this. If I could suddenly have a advanced FDA approval, having this be approved as a definitive diagnostic that is truly equivalent and alternative to PET in the sense that, PET is currently used to prescribe lecanemab. If I could have this technology be a prescription tool and a reimbursed prescription tool with its own reimbursement billing for that purpose, that's what I would want the most, because that would create financial incentive that is much higher than the current reimbursement for clinics, but it would do something even more important than that. Our product at the moment is sold for specialists, right? For neurologists treating Alzheimer's disease. There's about 20,000 of them in the US. But how many PCPs are there? There's about 300,000. The PCP isn't going to be able to interpret brain imaging with the same, familiarity or comfort or sheer ability as a neurologist. And so our tool is actually not so valuable to a non-specialist at the moment, because you must interpret the image, you must understand what you're looking at. But if we could have it be approved as a diagnostic, well, the product can be used in a different way. The product could be used, as I mentioned, to prescribe without needing to necessarily understand what you're looking at. And so that's another way that we can improve access. Instead of having a market limited to 20,000 physicians, it can increase to 300,000. So that would be one magic wand. I would say that the other magic wand would maybe be to find...
I'm getting one. No, I'm just kidding.
You're a genie. Don't I get 3 wishes?
Yeah, you can.
No, but there is another magic wand that is a bit more feasible, right? Because that magic wand doesn't exist. I just have to work on this for 2 more years. But that other magic wand would be if I could somehow help doctors understand the value of this technology more quickly and more easily. I had a phone call with a physician just last week who was very interested in our technology, wants to use it at his lab, but he shared a concern that a lot of physicians will have at the beginning of hearing about this. We're using CPT codes that aren't different from CPT codes that you can use without using our products. I tried to explain that you might do that code one time on a patient and then that's it, and then you never bill for it again. But with our technology, you get to use that code more regularly. It's still difficult to have that conversation and have it be quickly and easily understood. This same physician asked me, well, what do I do if I see that the therapy that I gave them is not working, right? It might seem like a naive question. But the obvious answer is, well, change, right? Drop the therapy, try something else. But, we're dealing in a world where the physician cares so much about the patient, and prescribing the wrong therapy can have adverse negative reactions. There's a lot of caution here. There's a lot of fear. We're not yet in a place where treating Alzheimer's is something that is done with confidence and with ease. And so if I could somehow, I don't know, I don't want to say be more convincing, but maybe if I could be more articulate, that would be really, really great. I still speak like a scientist, and I don't speak as much as a business person. So sometimes they actually have to tell me, like, okay, this is my concern. And it's, oh, okay, now I get it. You're worried because you think that you need to hire a new person on your staff, but you're a one-person clinic. And then I have to explain, oh, but you could do this yourself automatically. You don't have to watch the procedure be done to have it be done. So, there's all those little things that I wish I could address in the first conversation.
Yeah.
Like
I'm guessing that your technology is going to possibly, because if they find out that something's not working, then I would think that this could lead to finding a new avenue and a new treatment that will work.
Absolutely.
Yeah, which is really exciting. So you're going to be at the forefront of that. Your technology will be, because that's going to lead doctors to go, okay, wait a minute, this isn't working. It might work on these people, but it's not working on these people. So we need to now tweak something, and that's going to just move that advancement and that hopefully that treatment faster and moving toward a cure, which would be fantastic. Yeah. So last question. If I could bring you back in 12 months and we could revisit this conversation, which I'm completely intrigued with what you do, what would success look like for you in the next 12 months?
That's a good question. Success for me and within 12 months, I don't know.
And with your technology, it might be a little longer, because you said you would need 2 years to figure one thing out, because everything, in your space, things might take a little longer. So even if it's 2 years.
Yeah, I mean, if this technology were, used by at least one clinic in every state, I think that would be a good place to be.
That would be awesome. And that's very doable for patients too, to travel if they needed to. It's much more accommodating. James, for our listeners, how can people connect with you and reach out to you and learn more about Vistim Labs beyond what we talked about today?
If they visit vistimlabs.com, there's a contact form, right? There's a button right there on the homepage that says, basically get in touch. If you fill that out, it asks for your email and your phone number, and I'll happily, connect with you if you click that button. Thank you.
Perfect. Well, definitely go do that, because you'll hear directly from James. So no, it doesn't matter who you are that's listening, whether you're a physician, and it doesn't matter if you're a physician in any space. Physicians know physicians. So if you know of a doctor who's in the neurological space, please let them know about James and Vistim Labs. If you are a patient going through something, or you have a family member going through Alzheimer's, please definitely share this. Or if you know somebody who has a family member, knows someone moving through this, please share this episode and James with them. This is really important. More than ever, word of mouth matters for this, because there's only so much we can do promoting it marketing wise, but we need everybody, like boots on the ground, sharing this with other people, because that matters. So if you're watching us on YouTube, thank you. Like I said, please share this episode, send them the link. This can help a lot of people. And if you can subscribe, that would be great. This will allow more people to get alerted, you to get alerted when we have amazing guests like James on the podcast. If you're listening to, and leave James a note below on YouTube, let him know you heard him here. And if you're listening to us on your favorite podcast platform, thank you. Please share this episode with people that you know that would benefit from this. This is a huge epidemic in our country. No matter what age, you probably know somebody that's moving through something like this, and they could use this, a doctor that's using this device to help them with the treatment. And the more people that are aware of this, the more that we're going to find alternative ways to heal them through this device, or through this technology, because they're going to find out if it's working, the treatment that they're on right now, or even if it's not working. We need to know both of those. They're equally as important. If you can leave a review, we'd love that. 5 stars preferably. That allows the podcast platforms to push this podcast out to more people, so more people can hear James and his mission and his technology. And if you know of a doctor, definitely send them this interview. I promised y'all a gift, so here it is. If you're looking to grow your visibility and you feel like you've been throwing spaghetti at the wall, you're just trying different things, James shared with you what's working, what's not working for him, please go download our Spotlight to Scale blueprint. You can go to spotlighttoscale.com/blueprint. Grab that there. It's yours. It's free. Go get it. James, before I let you go, is there any last words, anything you'd like to share that I didn't get to ask you or we didn't talk about today?
Well, I guess the main thing would be Alzheimer's is not a death sentence. I know so many physicians who are successfully reversing this disease. Are they fully curing the disease or not? That's definitely still a question. But the papers are being published, the work is being done, the results speak for themselves. They're a minority, but they exist. And so the idea that Alzheimer's is a hopeless condition, that's an idea in the past. I believe that within the next 5 years, we will have definitive treatments that cure and fully restore function.
That's very exciting, because I can imagine somebody being diagnosed or a family member hearing that their loved one's diagnosed with Alzheimer's feels like it is a death sentence. So if you know of somebody, just know that there is treatment available. And definitely connect with James, because he knows the doctors that are reversing it, and that's key. So thank you, James, so much. This has been so enlightening for me, and I know for our listeners. I really appreciate you and your time and what you're doing in the world. So thank you for being you. Thank you for working toward this mission, and for your heart. I'm grateful.
Thank you so much, Heidi.
Absolutely. So thank you all for listening to James and I today, and I look forward to seeing you on the next episode of the Business Growth Spotlight.